ជំរាបសួរនិងសូមស្វាគមន៍ជាថ្មីម្ដងទៀតជាមួយនឹងសប្តាហ៍បន្ទាប់នៃសុខភាពឆ្អឹងខ្នងរបស់លោកអ្នកជាមួយ ICC រដូវកាលទី2នៅក្នុងសប្តាហ៍នេះផងដែរគឺយើងនឹងមកចាសំណេះសំណាលពីប្រធានបទនៃការព្យាបាលដោយចលនាសម្រាប់ការឈឺតាមសន្លាក់រាងកាយ Hello doctor, welcome back again to our next episode. In this episode we will discuss about the topic chiropractic care for extremities pain. So can you please describe your experience with this kind of problem?
Okay. So extremity pain is basically any pain that patient experiencing which is not related to the spine. So can be shoulder pain, elbow pain, wrist, knee, ankle. So there is a few different reasons for which people can experience this time of pain and condition. Number one is sport injuries, of course. So sprains like an ankle sprain, a knee sprain for people who play basketball, or can be an injury from a tennis player who's hurt his shoulder. So this is the first main group of extremity pain that we will be seeing at the clinic. The second one is a little more for senior patients, and this will be more related to joint degeneration. So the joints being wearing off, reducing the space between the bones and damaging the cartilage. Because of that, it leads to some inflammation, and that inflammation will be painful for the patients. So at ICC, we specialize in the treatment of all these different kind of extremity pains and condition. Of course, we are using chiropractic in order to readjust the joints, reduce the pressure on the nerves, which allow them to heal again the related area, and we are releasing tension on those different muscles. The second one, we are using physiotherapy modalities which help to speed up the healing process. So we are talking about laser therapy, ultrasound and electrostimulation mostly, which will help the patient reach faster their goal of recovery and also getting back to the field if they are a sport or an athlete. And for older people, the goal and the aim very often is to basically recover some movement, being able to walk again, being able to, for instance, lift up their grandchildren again, which sometimes they're not able to do anymore due to some of those different pains.
This is a very, very interesting topic, but the thing that I'm still curious is that because there's so many joints in our body, right? Especially like the fingers joint. Some patients coming with this problem of numbness in the fingers. So it's usually happen by the joint itself that having problem, or it's happened by some referring pain from other area?
Okay, that's a good question actually. It can be both. So for a lot of patients, it comes from the spine, so herniated disc that puts pressure on the nerve as we can see right over here. So the disc will put pressure, or the degeneration on the joint will put pressure on the nerve and can lead to numbness, tingling. In some other cases, indeed, this numbness or tingling are caused by muscles or joints which are not spine related. So one example, for instance, would be for some people indeed who are experiencing numbness or tingling on the palm of the hand, and it can be caused by a trapped nerve on the wrist area called a carpal tunnel syndrome. So in this condition, there is always something also related to the spine and the cervical spine and the neck, in the neck area, but the nerve is actually pinched in the wrist. So in our case, we will work on the wrist itself to restore all the flexibility and movement of the joints in this area in order to free up the nerve. But we're also going to release tension on all the way of the nerve. So we'll work on the elbow area, we will work on the chest area as well, in order to allow the nerve to communicate properly. It's a little bit like a hose when you're watering your plant. If you put pressure at any point on the hose, the water supply will be lesser, right? So what we're gonna do is is go and find all these different areas where the hose is pressed, where the nerve is pressed, and we are going to make it work better. We are going to restore better function so that we can improve these types of symptoms.
Wow, thank you so much. This is very, very detailed. Yeah. ចាអ្នកទាំងអស់គ្នាអញ្ចឹងអ្នកទាំងអស់គ្នាបានស្ដាប់រួចមកហើយចាតើការដែលឈឺនៅក្នុងសន្លាក់របស់យើងភាគច្រើនតែកើតចេញមកពីសន្លាក់មានបញ្ហាឬក៏អាចកើតចេញមកពីការគៀបផ្សេងៗនៅកន្លែងកអញ្ចឹងបើសិនជាអ្នកទាំងអស់គ្នាមានបញ្ហាទាំងអស់នេះហើយមិនដឹងថាត្រូវធ្វើយ៉ាងដូចម្តេចនោះចាអ្នកទាំងអស់គ្នាអាច comment សួរសំណួរនៅខាងក្រោមដុកទ័ររបស់យើងនឹងឆ្លើយសំណួរនេះឬក៏អាចចាណាត់ជួបផ្ទាល់ជាមួយនឹងដុកទ័រដើម្បីធ្វើការព្យាបាលឲ្យបានចំគោលដៅចាហើយនាងខ្ញុំក៏សូមអរគុណខ្លាំងមែនទែនដែលអ្នកទាំងអស់គ្នាបានចំណាយពេលវេលាដើម្បីទស្សនាតាំងពីដើមរហូតដល់ចប់នៅក្នុងវគ្គមួយនេះផងដែរចាហើយនាងខ្ញុំក៏សូមសន្យាថានឹងផ្ដល់នូវអ្វីថ្មីបន្ទាប់ទៀតនៅសប្តាហ៍បន្ទាប់ទៀតចាសូមអរគុណនិងសូមជម្រាបលា